Are you tired of dealing with recurring UTIs? Antibiotics may provide temporary relief, but what if nature holds the key to lasting prevention? In this video, we will explore how plant-based remedies can help stop UTIs before they start, gently, effectively, and naturally. Stay tuned to learn more about harnessing the power of nature for a healthier you. Welcome back to Kawira Herbal Remedies. Today we are going to look at natural remedies that can help with recurring UTIs. UTI is urinary tract infection. Welcome. All I want to reassure you, you are not alone in this. I have gone through the same, and I think I can share my wisdom with you today. So, what is UTI? UTI, or urinary tract infection, occurs when there is an infection in the bladder, urethra, and sometimes goes up to the kidneys. And the cause of this infection is usually a bacteria called the E. coli. So this E. coli will go and grow inside your bladder, and it sticks there because it has biofilms, and it's so difficult to remove it. So how can you know that you have a UTI? I can take you through some symptoms that normally one experiences. Number one, you have that urge of frequent urination. You feel like going for short calls, but when you go, even sometimes you don't produce anything. You have lower back pain. You also experience, some people experience fevers. There is also a lot of pelvic pain just below your abdomen, and you also feel some pins and needles behind your back. Let me tell you guys, when you start feeling such symptoms, do not start to think it's maybe a backache or something. Just rush to the hospital. So when you go to hospital, the doctor will just recommend something called urinalysis, that test, just to check what is in your urine. And once it's collected, normally if it has the bacteria or an infection, the white blood cells, which are called the leukocytes, are normally so high because they are trying to fight this infection. And then the nitrate level are also so high. So this means you need some medication right away. And mostly the most recommended medication that is guided by a doctor, which is normally prescribed, is an antibiotic. This will be based with the severity of the infection. Sometimes now, during the recurrence, the doctor can recommend culture. Culture is when now the urine sample is collected, normally the midstream urine. When it's collected, it's now taken to the labs, and they analyze the kind of bacteria that is, that is disturbing you, that keeps you, that makes you get the UTIs all the time. And mostly, let me tell you guys, it's usually the E. coli. That bacteria is so stubborn. So from the culture results, the doctor will be able to see how sensitive or which drugs are resistant to this bacteria, especially the antibiotics, so that the doctor can know which direction to go in terms of treatment with antibiotics. I thought you should know that, so that you may not mistake UTI symptoms with a backache. Saying you bent somewhere, you started, straining your back. Don't mistake those symptoms. That's why I put that red alert out there. So, what brings about this recurrence of UTI all the time? So as I said, once the doctor has the lab results, especially the culture or even the urinalysis result, they'll know which antibiotic you should be placed on. And so when you're placed on the antibiotic, let's say like me, then I decide not to follow instructions of how I was told to take the antibiotic. So this antibiotic will not give its full effect. And what will happen? You will not be cured. And if this is the initial infection of UTI, it will now start recurring and recurring because of poor adherence. You did not follow the right dosage, the right timing, you did not complete the dose. So now the antibiotic has not worked. So that's why there's recurrence. Number 2, hormonal changes, especially among us. Like now, me who is in my 40s, I should be so alert about what is going on in my body. I should not assume any discomfort in my body. Immediately, I should go get checked. And even if I'm talking about the plant-based herbs, ensure I've been checked and I know what I'm doing. So when you have hormonal changes, especially when you are going towards menopause, a lot goes into change and your body is changing and so many things are happening. You find that's where now you find you're getting such infections and they are not healing. Even your immunity goes down because a lot is happening with the estrogen, progesterone, and a lot of confusion is going on. Number 3, chronic diseases like diabetes. It's recommended if you are experiencing recurrent UTI, you should have diabetes checked because sometimes diabetes, recurrent UTI could be as a result of diabetes. So get diabetes checked. Let it be ruled out you don't have. It's just the UTI. Number 4, lack of hydration. You hardly take water or you take too little. How much water is recommended? At least 2.5 liters of water. It doesn't mean you just flush water in your system. You just take it, periodically, sips and sips. I will explain better later in this video. Number 5, there is also urine retention. Sometimes the bladder can be left with some amount of little urine, and mostly in men, when they have the enlarged prostate gland, there's usually urine retention, and this could lead to recurred UTIs. For women, ensure when you go to the washroom for the short call, you empty your bladder completely, the last drop, so that you don't have any urine retention. Number 6, antibiotic resistance. And this is now where I always say, if you can use natural remedies to manage UTI, you are good to go. When you go to hospital with UTI, let's say round 1, you're on this antibiotic, you completed, and the UTI came back after 2 weeks, you are given another antibiotic, fine. You stay, you complete maybe 1 week dose. After 3 weeks is back, you're on another antibiotic. Okay, you complete. After another, now it's like you're on antibiotics for 4 months or even 5 months in a row, which is so serious. And this can lead to antibiotic resistance, meaning that it will be hard to treat the infection because now you've taken so many antibiotics and they seem not to work. Number 7, also our personal hygiene. Do you air out your innerwears? Are they dry the way they are meant to be? They say they should be crispy dry. The kind of washrooms you use, do you put Do you flush before use? Do you put tissue inside? How you wipe yourself? Is it from back to front or front to back? Okay, recommended is you start from front to back, but if you do back to front, you are prone to infection. So let's see how we can treat all this using natural remedies. So as I've said, there are some natural remedies that can help prevent recurrent UTI, and they are very natural. So what happens is, you can't be, after you finish your antibiotic dose that you've been given at the hospital after diagnosis of UTI, complete that antibiotic, go back and ensure that the UTI is clear. Now when you come back home, you have to start managing and preventing recurrence of UTI. And these are some of the natural remedies you can use at home to manage recurrence of UTI. Here we have cranberries. Cranberries are rich in a compound called proanthocyanins. That compound helps the E. coli not stick to the urethra or the bladder, wherever it's stuck. And once you eat them, like now these are dried cranberries, what you do in the morning, the first thing before you eat anything, chew a tablespoon, chew slowly so that the sugars, actually it's very sugary, so that the sugars just go into your body, because it's that sugar that prevents the bacteria from sticking on your urinary tract. So chew in the morning 1 tablespoon and chew in the evening before you sleep, and make sure you empty your bladder before you sleep. Another way you can use the cranberry is a cranberry juice. Kindly note, this juice is not from the supermarket. Those all you bought from a shop. The ones from shop mostly have additives, sweeteners, they have preservatives. This one I've prepared at home. I've used 1 tablespoon of cranberries. I've soaked in some warm water throughout the night for 12 good hours when I've covered, and you can see the juice is right there. It has no sugar. It is just the way it is. Just cranberries that have formed their own juice. If you take this during the day, this can really be helpful. I'm telling you, I'm a testimony of these cranberries. They really work. I don't know the last time I took an antibiotic due to UTI. So try them, and that's the best way you can take it. For supplements, the ones in a container, I would say I prefer natural, because I know there are no additives and they are just fresh from the plant. So another natural way you can reduce or manage, prevent recurrence of UTI is through probiotics. Here I have unsweetened yogurt. There it is. This is Greek yogurt, or you can buy natural plain yogurt. And this yogurt, I've just put some cranberries on top, you can see, so that when I'm taking it, it has a very yummy flavor, and it's still doing its probiotic action, whereby now after you take antibiotics, what happens? Even sometimes antibiotics get rid of the good bacteria, and as they get rid of the bad bacteria, they are getting rid of the good bacteria. So the probiotic will help improve and increase the good bacteria in your body, so that you have good immunity. That's the natural yogurt with some cranberries. Another probiotic is the sucrot. This is a very great probiotic. I made little. I like making little because I don't like it staying in the fridge for a very long time. So what you do is just clean, buy a big cabbage. For me, I used a quarter here. So you clean it, dice it small, then you add some salt. Like this one I use half a teaspoon because it's little. Then you rub it in a different container. Then after you're done, you put it in such a, you knead it well first. Knead it well until it produces its own water. Then now you put in such a glass container, this is glass, and cover it airtight, and make sure don't fill it up to the brim because of the fermentation property. Now you keep it in a very cool and dry place for around, I normally do mine for around 7 days, and I'm good to go. This one will take me 4 days because I only take 1 tablespoon per day, just to improve the normal bacteria in my body, have more vitamin C, and get the vitamin K in these sucrats. So another way that you can prevent recurrence of UTI is by drinking water. Guys, stay hydrated. When you take now something like cranberry, you know this is dried. How will this bacteria flush out if you don't take water? So if I take the dried cranberries, after I chew them, I normally sip in some water. As they go down, I know they are going to the urinary tract. Once they reach there, they'll flush out that bacteria. You should try these natural remedies. The cranberries, the probiotics, and stay hydrated. And we said 2.5 liters of water. And this water, let me tell you guys, you can get it from, if I drink this glass of water, wow, it's part of the 2.5 liters of water I've taken. If you drink a cup of, let's say, hot, maybe chocolate or something, that's also water. So don't just keep flashing in water, flashing in to go to the 2.5 liter. All these watery contents that you're taking are all water, but make sure at least 1 liter or 1.5 is water that is plain. You just sip it, you stay a few moments, you sip again. That's how we keep our bodies hydrated. So there's something I've discovered in my journey when I used to have recurrent UTI. And it's the food I used to eat sometimes, so especially beverages. I had to stop carbonated drinks. I don't do them anymore. Every time I used to take carbonated drinks, UTI strikes. Then caffeine, especially coffee. Every time I used to take coffee, UTI strikes. The last thing that will surprise you that used to strike recurrent UTIs for me, a lot of eating acidic foods. Let's say like the lemon. My body cannot tolerate it because if I eat that lemon, instant UTI. So I've tried to avoid them, and to improve my vitamin C intake, cranberries is rich in vitamin C, and the baobab that I mentioned in one of the videos is rich in vitamin C. So that's how I enrich my vitamin C. Now that I can't do oranges, even I can't do oranges, I can't do lemons, but I'm okay avoiding caffeinated food, carbonated, and some citric acidic foods. I hope you've learned and you've enjoyed this video, how you can do these natural remedies just to prevent recurrence of UTI and reduce hospital visits and too much exposure to antibiotics. See you in my next video when we get to explore how plant-based herbs, so this is a plant-based fruit, can really help improve your health. Bye-bye.